What are the best treatments for moles and melanoma?
So with regards to moles, if a mole is harmless, then it doesn't necessarily need to be treated or removed unless it's causing some concern or discomfort. If, however, I suspect that a mole might be more than a mole and it could be a melanoma, then what I might offer you, and this is mostly on the same day as your consultation, is removal of that suspicious lesion. And it's not until we remove this spot and send it off to the lab that we can confirm whether it's benign or whether it is in fact a melanoma. And the first treatment essentially consists of just that, just removal of what we can see with a small margin of healthy skin around it, under local anesthetic, and with a few sutures to close the skin. And that's the beginning of the treatment. It serves as a biopsy and the beginnings of your treatment. Now, if the biopsy shows that this is a melanoma, then the treatment again would mostly consist of further surgical treatment. So it does depend on the stage at which your melanoma is, and that tends to be determined by the lab when they look at things under the microscope. And that can give us an idea of really what type of surgery we are talking about, because in the majority of cases, the next treatment simply consists of taking a bit more skin from the surrounding tissue, from the scar, and essentially just taking the scar away and creating a slightly longer scar. So if we actually need to take a larger proportion of skin, then the best option would be to arrange a consultation with one of my colleagues who are plastic surgeons, so that you can have a further assessment to discuss what that treatment involves, because you might require something a little bit more complex in terms of repair of the wound. In certain stages of melanoma, we might want to sample the local lymph nodes, but that's not always necessary. And again, in certain stages, we might wish to do some further investigation, such as a scan. But having said that, thankfully, most melanomas are caught at a very early stage, and those investigations and treatments are not necessary. In the vast majority of cases, I would see you for the original removal of the mole or suspicious lesion, and that would be followed up by consultation on the diagnosis and further surgery on the day again, and you get to go home on the same day.
If you notice that you have any of the symptoms or the conditions that we've just discussed, we invite you to book a consultation with Miss Penelope Pratsou, where she'll be able to assess your condition and give you a treatment plan.